Welcome to the YWCA Hartford region, and thank you for tuning into our Community Matters, timely conversations to bring us together. Here at the YWCA Hartford region, we are on a mission to eliminate racism, empower women, and promote peace, justice, freedom, and dignity for all. This year, Community Matters is intentionally connecting you with the artist community to bring forth vivid depictions of our subject matters in a way that connects to our audience emotionally and prepares us to digest these complex subjects. Check out this clip from the Judy Dorwin Project.
My name is Judy Dworin of JDPP, and we are an organization with a commitment to arts and social justice. We have been doing residencies at York CI for Women since 2005 that offer arts engagement as a way to express and develop self, build community, and facilitate healing. The arts work that we do there is transformational, and we and others see the tremendous growth that happens each year and over the years. With DOC permission, we are able to take some of this material out to the community, performed by returning citizens and the JDPP Professional Ensemble. The brief excerpts you will see here are from community performances of pieces generated at York and in New Beginnings, a JDPP reentry outreach, and gives you a sense of the power that such creative expression holds for healing. Thank you very much.
Four walls, one floor, one ceiling. Four walls, one floor, one ceiling. Four walls, one floor, one ceiling. But no windows, I'm still feeling. I'm feeling perpetual loneliness. Stubbornly human. Perpetual loneliness. Stubbornly human. When I was 17, the man that was supposed to love me started to abuse me. When I was 22, I gave birth to my third child. When I was 23, I was sentenced to 10 years in prison because I assaulted that man that was supposed to love me in a domestic dispute. I love being a mother and having lots of pictures of my children. When I went to prison, he burned all of my pictures of my children. Those pictures, you burned them by fire and hate. Those pictures were my everything. You destroyed them from anger. Those pictures were physical, but their memories are stored in my mind, body, and spirit by God. You may have burned them, but I burned those pictures into my heart and soul.
There are days when I want to fling open all the doors and the windows in this place and shout to you and to the world and say, I'm sorry. I am sorry. But the doors and the windows do not open here. So I do the only thing I can do. I stay inside and I close my eyes and I pull your face up onto the picture window of my mind, and I see you standing there, happy, healthy, throwing your head back, laughing in the blue rain. And I get to look at you face to face and say to you, I'm so sorry. And you say, I know.
That was truly, truly a moving excerpt from that overall masterpiece. Thank you, Judy and the Judy Dorwin Project and all of those that work in collaboration with you for sharing that excerpt with us and giving us insight into some of the experiences of incarcerated women. The YWCA Hartford region this year has invested our interests, support, and resources in a very particular topic that impacts women, and more specifically, incarcerated women. Our topic of conversation for today is a call to improve public health by regulating healthcare provided by the Department of Corrections. And it is my pleasure to introduce our panelists. First, we have with us Marisol Garcia. Marisol Garcia is a rising senior graduating from Trinity College with a bachelor's in public policy and law this May. Marisol is an advocate in healthcare reform and reentry services for the formerly incarcerated and hopes to represent those interests after graduating from law school. YWCA Hartford Region is proud to support Marisol's pursuits and advancement as she currently serves as our public policy intern this year. Welcome, Marisol.
Thank you, Melinda.
Our second panelist is Dr. Joseph V. Breton. Dr. Breton completed his residency in 1999 at Stamford Hospital, where he served as chief resident his third year. He was in private practice for 15 years in Enfield, Connecticut. He worked as a physician for DOC for 3 years before taking the position of chief medical officer for the state of Connecticut Department of Corrections. Dr. Breton, thank you for joining us.
Thank you.
Glad to have you. Our third guest, Tahiba Bain, is founder and executive director of Women Against Mass Incarceration, a grassroots organization empowering justice-involved women, girls, and families. Tahiba played an integral role in passing legislation in 2018 for incarcerated women and girls in the state of Connecticut. She has been appointed to sit on the African American Subcommission of the Connecticut General Assembly, Commission on Women, Children, Seniors, Equity, and Opportunities. In the past, she sat in the Mass Incarceration Subcommittee for Governor Ned Lamont's Transitional Policy Committee. She also participated on the Task Force Commission for Collateral Consequences. Tahiba received dual bachelor degrees in psychology and women in criminal justice from CUNY Bacualte. Oh, don't let me mess it up. Interdisciplinary and Unique Studies program, and she is an alumnus of the Justice and Education Scholar Program at Columbia University. Tahiba, welcome. And if you could, please correct my misinterpretation of that.
It's the laureate.
Thank you.
You're welcome.
Last but finally not least, and no stranger to us, we have with us State Senator Saud Anwar. Senator Anwar was elected in February 2019 to represent the residents of the 3rd State Senate District towns of East Hartford, East Windsor, Ellington, and South Windsor. Saud is a medical doctor with specializations in treating lung disease and critical care medicine, occupational and environmental medicine. He currently serves as chair of the Department of Internal Medicine at the Manchester Memorial and Rockville General Hospitals. Saud was trained in pulmonary and critical care medicine at and holds a master's degree in public health from Yale University. Senator Anwar, glad to have you with us.
Thank you so much for having me. Thank you.
All right, well, ladies and gentlemen, let's drive right into this conversation. Setting a little bit of background here, access to health care for incarcerated persons is a constitutional right covered by the 4th, 8th, and 14th Amendment. In Connecticut, from 1997 to 2018, health care was provided to individuals in DOC custody as contracted through the University of Connecticut Health, UConn Health. To date, Connecticut is the only state where the DOC operates and oversees its own healthcare system. The Department of Corrections currently operates approximately 18 facilities in the state of Connecticut. So with all of this history now laid before us, Dr. Breton, as a healthcare provider who has worked behind the walls of DOC operated facilities during both the UConn contract and post-contract, could you share with us your experience and why the current lack of third-party oversight of the Department of Corrections healthcare is so problematic?
Yeah, so first of all, that was a great history of DOC and the prison healthcare system, right? So the University of Connecticut had a no-bid contract for all of those years, anywhere between $100 million and sometimes a little bit higher, $1 million a year. It became evident, I believe, to DOC that the healthcare system wasn't working too well as they hired independent contractors to come in and I don't want to say investigate, but kind of take a look at the healthcare system. When that report came back, probably around 2017, it was decided that it would be best for Department of Corrections to take over the healthcare system from the University of Connecticut. And one of the problems that I come from a background of a private office, right? So healthcare was very easily accessible to the patients that I had in the Enfield area. When we went into the prison, obviously, the inmates don't really have a choice, right? They only have the one person they can see. Mm-hmm. I think there does need to be an oversight committee to take a look to make sure that we're meeting something called the community standard of care. I mean, at a minimum, the prison system should have the same level of healthcare. So I was in Somers, Connecticut. They should have the same healthcare as the people in Somers and Enfield. So without a real third-party oversight, there's nobody to report if they do find that there's an issue with healthcare, like potentially long times for inmates to get a referral to a specialist, or can they even get a referral to a specialist? And that's why DOC took it over, because the view was that they were not meeting the standard of care, because if they were meeting the standard of care, nothing would have ever changed.
Mm-hmm. Thank you for sharing that. And in fact, when you talk about some of these reports, in March 2019, the Department of Corrections reported a ratio of one nurse on staff for every 43 prisoners and one doctor on staff for every 579 prisoners, according to the Office of Fiscal Analysis. So with this kind of data present, how is this a safe and healthy, or how is this a health and safety issue for incarcerated persons and healthcare workers alike?
Yeah, so, if you know my background, you know the issue I have with that, right? We cannot provide healthcare with those ratios. It is impossible to do. There's no physician that can take care of 500 inmates. And you have to remember, this population is often not the healthiest of individuals, right? They're not from Greenwich with a personal trainer and a personal chef. These are people that need a lot of healthcare due to underlying issues on top of where they are, which adds an incredible amount of psychological stress. So I believe, and you may be aware that Department of Corrections did have that company come in to see what would needed to be done to make things better. After that, they did hire a consultant to come in to take over the healthcare system. And the outline that the consultant gave to DOC was perfect for exactly what they needed to do to make the changes to get the standard of care to meet, at a minimum, the community level of care.
Thank you. Senator Anwar, is there any additional comments
Yes.
to that question?
Thank you so much. I agree with Dr. Breton, what he's saying for sure. I think what we have seen is that the lack of oversight, all private practices, all the hospitals, we do have a responsibility and are reported to a higher authority besides our higher authority that is beyond the higher authority in the state. But Department of Public Health oversees some of these facilities. At a minimum, Department of Public Health should be involved, and I agree that an oversight committee needs to see if we are doing the right thing. My argument also is that, look, when we don't provide care to some of the inmates and some of the individuals in the correctional facilities, when there are bad outcomes, we as a state lose out. First, the emotional pain, physical pain of the individual, but their families. And on top of that, there is a financial cost when we don't provide the standard of care that should be a bare minimum that we should have. And that's something that is not there at this point. So we have to address this for sure.
Thank you. And an example of this is Connecticut is home to York Correctional Institute. And that is where we learned of an incident in 2018 where Tiana LaBoy had not yet been convicted of a crime when she gave birth in her cell in a toilet at York Correctional Institution. And during the trial of this case, it was recorded in court documents that the OBGYN was available only Mondays, Wednesdays, and Fridays, despite serving a population of patients that could go into labor or have another life-threatening emergency at any time. So this year, advocates call for legislation that codifies West versus Manson. Dr. Anwar, Senator Anwar, how could this legislative act prevent future incidents like that of Ms. LaBoy?
Thank you so much. And I wanted to also first thank YWCA for your advocacy. You have been very clear in advocating through many legislators, myself included, to raise the awareness about what needs to be done. We have, through the from Public Health Committee, a legislation coming forward, which is going to look at codifying West v. Mason. Look, whatever happens in the real world right now, we recognize that we don't have standard of care in a law in the state, as a result of which, whenever there's an argument, people say, well, we don't have any specific guideline of how to have the ratios be appropriate for the patients. We don't have guidelines what to be able to how do we take care of the patients. And well, we are going to put that in writing so there is no confusion that the patients are going to have the same standard of care, the ratios are going to be appropriate, everything will have to be spelled out so that there is no confusion, because there are so many traumatic incidents that are happening within the correctional community. You can see what happened in the pandemic in the recent past, which is again showing the rate of spread, the lack of appropriate care, and then not only that, the checks and balances have been absent in the entire process. So people do not have any opportunity to even complain about it. So this bill that we are working on through the Public Health Committee is going to actually codify some of the requirements, including substance use issues, including women's health responsibility that we should have, requirement of physical examination, screening of individuals, and appropriate treatment. Many of these individuals will need behavioral health. They will need dental health. They will need overall complete health care that any one of us would expect in the community. And that's something that we are hopefully going to be able to achieve through this bill.
Thank you. And Tahiba Marisol, we certainly want to invite you to jump in on this conversation whenever there's a topic that plucks at you. Marisol, I know you in particular have looked very specifically at the West versus Manson case and those components that dealt with reproductive health. Is there anything that you would like to speak to? You're muted. Let's unmute.
I apologize. Yes, I apologize. I specifically on the reproductive health aspect of things, I look at it because it has personally affected me. One of the things that they would talk about is, you know, having services available for women who come in as they are pregnant, women who are looking for you know, abortion if they need to due to health complications and other issues. Because other women that I interviewed during this process, when I was looking for testimonies, I heard many young women who were 24, 25, talking about, you know, they had fibroids and other issues that were affected. And while they were in custody, these issues were just swept to the side and were not addressed at all. And now one of them has come home and is having the complication of not even being able to possibly have a baby due to the fact that her issues were brushed to the side. She was unable to see someone from DLC, from the healthcare unit. And for me personally, I speak on the end of it from a woman who's almost 45 and I have no children. During my time while I was incarcerated, you know, I always thought that I would be able to have kids. I now can't. And it's not, you know, it is not to say that DLC is to blame. However, you know, the quality of care and the level of care, you know, we speak about bare basic minimum. There is no bare basic minimum. It's sub level to that. And listening to all the stories that I heard and things from young women who, you know, came in with substance abuse issues, who now are affected by these things because they weren't given the basic essentials. I say it's a must in order to have these things because it affects quality of life long after they're released from prison, long after.
Thank you, Marisol. For those that are listening and tuned in right now, and you're wondering, just wanting a little bit more information on what West versus Manson is it is a particular case that came up in your correctional institution in the 90s, in which a woman was seeking. Several women were seeking their rights to be evaluated when it came to what kind of health care they received under the provisions within your correctional institution. And some very specific things that were marked out under reproductive health care include access to abortion and access to contraceptives and access to OBGYN care, which is essential for women at all stages and all ages of life. Tahiba, when we think about women that are returning to their communities and we think about reproductive health care, what are some of the impacts that we can see as obstacles for women that have not had adequate health care while incarcerated, now re-entering back into society? You're muted.
As usual, and as always, I do apologize. I just want to say thank you. This is a great topic. People don't talk about the healthcare system concerning the DOC and formerly incarcerated and incarcerated women and girls as far and the population in whole. So I just want to say thank you. This is really great, and I appreciate you having me and actually holding this panel. So I want to just first go back and to talk about how the lack of oversight for the prison healthcare, like even when UConn had it, it still wasn't really oversight. That's why Department of Corrections felt they needed to take it. But now I think it's gotten even worse because of the lack of oversight. And with that, and Senator Anwar said it, like we definitely need it. So I look forward to seeing the regulations and the bill being passed to actually put that up forth, because without anyone actually having to be held accountable, anything and everything happens in there. We have women inside of the prison right now that's doing transgender care, right? Mm-hmm. Transitioning and doing that medicine, but they are being also ostracized in the process of doing it, right? From the medical facility, from medical staff, as well as the staff itself. And they're not getting the proper care, the proper estrogen that they're, or hormones, or whatever it is that they get, they're not getting it. We get letters every day almost about the lack of care for the hospital and healthcare inside of prisons. I met this one young lady who deteriorated over time in prison. And now she actually cannot work. She cannot come. She came home and she doesn't, because they didn't take care of her inside of prison, she is now on Social Security and healthcare benefits for the rest of her life, and not being able to like be with her grandkids, because her kids are grown at this point, but her grandkids, she can't play with them, she can't run with them because of the lack of attention to the healthcare. Like Miss Marisol said, it's sub-level to any healthcare that we out here get. Even the people that are on what the welfare and Husky and all that, it's even below that, and we are treated in that regard to like, oh, you're just this type of person because you go to the community healthcare centers, right? So the community healthcare centers, you coming home with a severe case of an internal non-healable type of condition, it's even worse, because now they can't afford to pay for the rest of their medical bills. Medicare and Medicaid doesn't pay for all of it. This one lady have cancer. She can't even get cancer medicine because of she can't work. So she get her cancer medicine. It's cut off at a certain point, but then here you go, you got to pay for the other half of it, and she can't. She can't. So it's taken away from not just the person, but the families. This one young lady, she has a teenage daughter that right now really needs her help, because we're dealing with a whole bunch of stuff, and she trying to keep her kid from going into the community and seeking the type of help or type of things that she need, that she can't really afford because she can't work. She has to focus on her health. And her daughter is like, well, mommy, I'm a growing teen, I need things too. So now she's caught between all this. So that's how it's affecting all of us in the whole. So it's really a situation that needs to be addressed on a higher level, and then implement it and help. And we should hold them accountable, because a lot of times bills get passed and legislation get passed, but then there's no accountability part to that, right? There's nobody making sure that what's being passed is actually being implemented, and that is also something that we need to address as well.
So Heba, you've opened up quite a box and identified so much intersectionality in this issue. And I want to thank you for including in your remarks our trans community, that when we talk about women at York Correctional Institution, we're talking about all women. Yes. And the importance of that and the identities that are intermingled in that. So thank you for sharing that. And also, when you speak of the grandmother and her grandchild, the woman and her child, it is without saying that we recognize that women are truly the backbone of society, that to every woman, there is an extended community that she is a part of. And so these ailments that women are returning home with, these are ailments that they're returning to their communities, and the weight of that is then on their communities. Thank you for sharing that. Senator Anwar, I think I heard you chiming in.
Yeah, I wanted to just share a couple of thoughts as well. First of all, it's fascinating because so much value each and every one of you are bringing to the conversation that's going to help. And I would love for you to testify when we have the bill and the public hearing around it. I just wanted to share, you should think about continuum of, even for women's health, diabetes, hypertension, high cholesterol, those very basic chronic illnesses will remain part of the bigger picture. And now there's a pre-incarceration health and there's a post-incarceration health. There should be a transition of care in such a manner. Right now, there is essentially no communication happening about the health of the person pre-incarceration. And then there's no communication post-incarceration. So having that communication of the medical records, tests, and everything should be seamless and should be expected, just like in any other scenario. There is a way to do this, because what happens is that people have this disjointed care and there's lack of information, lack of medications, and so on. So that's something that has to be part of our expectations from the Department of Correction as well.
Agreed. Thank you, Senator Anwar. And, reflecting back on even my own healthcare, I remember being pregnant with my second child and starting my journey at one hospital here in the city, and then realizing that I wanted to transition to another hospital. And there was no question in my mind that the second hospital would contact the first and acquire the records. and that the conversations that I had with my physicians, the record of the medication that I was on, that all of these things would naturally transition and we would move forward seamlessly. But to your remarks, people are exiting, women and men alike are exiting their incarceration experience and re-entering into society without that communication, and a communication that's so essential to their well-being and the well-being and the public health of their community. Thank you.
Melinda,
Yes.
can I comment on, you just made a very interesting statement regarding of people who have been incarcerated and are transitioning. So in several of the conversations I had for testimonies, I had conversations with people who were incarcerated for 15 and 25 years apiece. And one of the biggest things that I heard all across the board in all the testimonies I received was that in trying to obtain their medical records from DOC, it was like trying to get a secret out of Fort Knox. Phone calls, requests from providers, ignored, no response, nothing. I had a story where a woman said that while she was incarcerated, 10 years into her time, she fell off her bunk and tore her knee. And she was just released about maybe 4 months ago. She had to go to the doctor with no prior records. They told her that because there was no follow-up, they told her while she was incarcerated there was no need for anything. There was nothing they can do for her. So there was no referral, no examination. She is now she was released without any type of post-release insurance, no medical records. So she is now with the responsibility, the expense, and the fact that she's lucky enough to have tribal insurance, but she has no state insurance. And she's now coming out of pocket, and the whole process of trying to be able to get any type of insurance, any assistance financially, emotionally. And she's trying to care for a 17-year-old child that she just came home to after 15 years of being incarcerated. And you speak of men, how this affects men. One of the stories I had, one of the men was incarcerated for 3 years. He's 28. And he said he came home and put this responsibility on his mother to being able to get health care, to be able to get appointments. And she ferried him back and forth because he wasn't able to drive. He had no job and all these different things. So now they, once people are released without these basic essentials of insurance records, people are not able to go transition directly into trying to get employment. They don't have the basic appointments to be able to even have somewhat decent health. So they have the stress of trying to keep doctor's appointments, get records, try to hold down the job, try to reunify with their families, friends, and communities. And all these things are a stressor upon the individual, male and female alike. Without this bill going forward, you can very well see that without this happening, all this does is it racks up unnecessary expense for the individual, the state, and it causes havoc within the communities because it puts strains on whatever services we do have. It puts strains, and we already know with the pandemic, it's already at an all-time high. This is just only adding to an unneeded stressor.
Thank you, Marisol. Our panelists so far have really emphasized the cost of being sick, the cost of not being well, that we're not just talking about pharmaceutical costs, but we're talking about the cost of time and energy. We're talking about even shortened life expectancies as a result of this. We're talking about diminished quality of life as a result of ill treatment and ill practices when it comes to healthcare under the care of the Department of Corrections. But there's also a cost associated to the state of Connecticut. In 2020, the Tiana LaBoy case reached a $250,000 settlement. Connecticut has paid out millions of dollars in lawsuits related to medical negligence with the Department of Corrections. There is a deeper cost to families and to communities of returning citizens, especially when it comes to returning women. Senator Anwar, would you like to speak a little bit more about why this compelling argument that we're trying to make here regarding regulating DOC healthcare is not just a moral argument, but it is a cost-effective argument?
Yes, I can share. Thank you so much for sharing some of the data and the information. Here's the reality. Whenever something would go wrong, the lawyers on the side of the victim in this situation is going to ask the experts and say, was the standard of care followed? And the answer right off the bat is going to be no. And if you look at some of the cases, they're heartbreaking cases, like an 18-year-old who had an autoimmune disease, who kept complaining, and nobody gave that individual the opportunity to get the tests and have the treatments that would have saved that person's life. And we lost an individual who could have had be with his family right now. And then when you have these horrific cases, you realize that the emotional trauma is huge, but an individual died because the standard of care was not practiced. And then if we practice the standard of care, the likelihood of something going wrong is going to be much, much less. And then actually the state of Connecticut would have legs to stand on in some of these lawsuits if we were doing something right. I just want to add one more thing when we talk about the cost. The behavioral health and the mental health issues. Sometimes individuals who are incarcerated, that incarceration is a symptom of a mental health illness that was never identified or treated. And not having the systems in place to have a better treatment for that in the incarceration setting or after that is also opportunity lost to get a citizen who is contributing to the wellness of our society. I think so many opportunities are lost because of not having an appropriate healthcare system in this situation.
Thank you for that. You bring up mental health and you bring up so many components. Let me offer a definition. According to the Merriam-Webster dictionary, a dictionary that we all probably have been familiar with since elementary school. According to the Merriam-Webster dictionary, health is the condition of being sound in body, mind, or spirit, freedom from physical disease or pain, a condition in which someone or something is thriving or doing well. With this definition and these definitions at play, Marisol, why is the inclusion, and I'll extend actually this question to Dr. Breton first, why is the inclusion of mental, physical, dental, and obstetrics in quality healthcare essential for incarcerated individuals?
Yeah, and absolutely was just said. They are all interconnected. Most of the, not most of the inmates, but there's a group of inmates that are there strictly due to mental illness, right? Sometimes not even understanding what the law is or why they're even in prison, or that they're actually even in prison. I've seen inmates that have come in and I had no idea they were in prison. And when I got done talking to them, they asked me if they could go home now. And I had to explain to them where they were and why they can't. But there is that level that's out there. Luckily, the Department of Corrections does have a very good mental health staff, very dedicated, and I'm sure they could use some financial support as well. But these are all included. Dental and heart disease, obstetrics goes all the way through all of women's care. So all of these groups need to work together. And just one last thought. I just wanted to say that there's obviously some big gaps in the healthcare in the Department of Corrections right now. But I will say that the staff, the boots on the ground people, 99% of them are the hardest working healthcare people I've ever worked with. Mm-hmm. And they have such limited resources, but do everything they can to help. I think it's important that we do at least appreciate the hard work that they do every day, because it's not a great setting and they are very limited and don't have a lot of support, but they go in every single day and do the best they can.
Thank you for offering that. And most certainly we echo your sentiments. This is not a conversation at all to vilify the workers who are operating and doing their best currently under the Department of Corrections healthcare system. But this is to identify that the way that the system is currently operating is not helpful. It is not healthy, and it is not safe for those who are incarcerated or those who are trying to provide the care.
Absolutely.
Marisol, are there any additional reflections that you would like to share with us?
First, I'm going to speak to what Dr. Brenton was just saying with regards to healthcare for DLC staff. I was in the fortunate position of being a hospice volunteer while I was incarcerated. And I will tell you that you are truly correct that there are staff members who go above and beyond with what limited supplies and limited staffing they have to make sure they can try to provide the best quality of care they can within their capability. So that I will absolutely, as someone who's been formerly incarcerated and has served within the healthcare unit myself as a volunteer and as a hospice worker, absolutely. You know, the issues I can speak to for those who are currently incarcerated. I have a friend who has been incarcerated for over 25 years. She unfortunately will die within the prison walls. She has a palliative condition that is going to slowly but surely take away her quality of life. And one of the key things, Melinda, you said was for incarcerated individuals. And that's something I think they have to remember. We are individuals. Unfortunately, I think the stigma of incarceration sometimes puts this stigma, you know, once you're incarcerated, that it's okay to treat you like an animal. That's not okay, and it never is. The quality of care we receive when we are incarcerated and that follows us post-release needs to maintain not even a bare basic, but human aspects. And I think that right now, as we know, you know, due to short staffing and everything else, I understand that's right now sub-level, but it was even that way even before the shortages. So I think that's something that we have to remember. These things are not things that developed overnight. And even in reviewing Manson versus West, you see some of the things that were to help are still things that they are not even doing in bare basic. They're doing less than getting by. So that's just something that needs to be remembered and they need to be held accountable just for bare basics.
Thank you. Tahiba, yes, I was coming to you next for your closing remarks.
Okay. This is, I don't even want to end. Okay. So yes. As a formerly incarcerated woman, I do want to say that I too also, Marisol, worked as a hospice volunteer, and it was a sight to be seen. But there were also staff members that actually did go above and beyond in that particular stance. But I was also part of where the staff members, the healthcare members, did not go above and beyond, and compassion fatigue was something that was very visible on a daily basis there. And to the point where people didn't even want to go to Medline or Pill Line or even go to do a medical ticket to go and see a doctor if they were able to. So on both regards, we have it on both. And it's not to vilify, but it's just to make it clear that, yeah, there are some and there are some that are not. And as also, I believe the question was the mental health, how it all should work together. I think, you know, to what Dr. Burton, I'm sorry if I said your name wrong, but what he said about that young person, that person that was there and didn't even know he was in prison and was asked to go home right after the interview. It shows that we are putting people behind bars that does not belong behind bars, but belong in a mental facility that can actually focus on that type of care. And that is another breakdown. When we stopped actually putting people in a mental facility, but locking them up and expecting them to be a part of a society that they didn't even know they were being a part of, and, you know, causing more problems within themselves as well as the community in which they're placed in. So I think that we should think about how does that look? Like, how many mental care facilities do we have in the state of Connecticut that can actually help those people that need the help? We closed down a lot of them across the country. I think we need to start thinking about bringing those back as well. And that is another way that we can help the individual, whether he's incarcerated in the prison or incarcerated in a mental institution, to become a whole person again.
Thank you for that reflection. Yes, to your point, the last standing mental institution in that regards that is standing is the Connecticut Valley Hospital here in Connecticut. And that is also a space that is really left for treatment for very severe cases, when often individuals need a moderate degree of intervention in order to be able to proceed in life. So thank you for sharing that reflection, Tahiba.
Yes.
Senator Anwar, any final reflections?
I cannot thank the people on this panel, and I cannot thank the YWCA for your leadership. You guys are doing God's work. Only through your efforts can people get educated, and once we are educated, we actually can bring about legislation. We need strength of your strength to be able to make sure that we help people who are incarcerated. And I think there's a broader work that needs to be done. And I think that was touched on as well, about the humanity of individuals. Many of these individuals are no different than us. It's circumstances that have led them to get to that point. And we have to make sure that they come back in a position that they can be part of our community, and then enhance our state, enhance our capacity, and then give back to the community. And it's very doable. We just need to take care of that. Also change the mindset that when somebody's incarcerated, it's not a life sentence. They have paid their due. Don't act as if they are in a life sentence of being treated without respect for the rest of their lives. So thank you for all that you all are doing. Thank you.
Thank you. And thank you to all of our panelists for sharing from the depths of your heart and experience on this topic matter. We are so appreciative for you adding your expertise and your particular steps in life that have brought you to this place of supporting this issue. There is a coalition working on this issue, and we are at the YWCA Hartford region proud to be a part of and in leadership of the Regulate DOC Healthcare Connecticut Coalition. Our coalition is calling for legislation that makes impact in several areas, including requiring the oversight of the Department of Corrections healthcare by a third party, codifying West versus Manson, up-to-date, transparent, computerized medical record keeping, chronic disease management, epidemic management, and mental health management that does not use solitary confinement as a means of treatment, the establishment of a standard of care for the Department of Corrections, safe ratios and scheduling for healthcare workers and caseload management cap, the establishment of continuity of care, including collection of medical records upon incarceration, regularly scheduled physicals, preventative medicine and detox treatment for incoming inmates, and a discharge re-entry plan that is inclusive of a medical care plan. It is our belief that if these items are met, that we can improve health outcomes for the incarcerated and returning citizens, that we can reduce safety risks for the incarcerated and healthcare workers, that we can decrease Department of Corrections healthcare related litigations and liabilities, and we can then recruit and retain quality healthcare professionals. The Regulate DOC Healthcare Connecticut Coalition currently is comprised of ACLU Connecticut, ACLU Smart Justice, Hartford Health Initiative, Her Time Hartford, the Cattell Center for Equity, Health, and Justice, Planned Parenthood of Southern New England, Pro-Choice Connecticut, Urban League of Greater Hartford, Women Against Mass Incarceration, Voices of Women of Color, and Solidarity Connecticut, and the YWCA Hartford region. We are grateful, truly grateful to our panelists, and we encourage you, if you are looking to get involved with the YWCA and our overall advocacy initiatives, that you stay connected and take the pledge to create a community without racism, and join our advocacy community to receive updates and information on ways you can make an impact in your community. Finally, as we are awaiting a bill number and a public hearing on this very important topic, we encourage you to stay connected with us on our social media outlets at YWCA Hartford Region. As always, Thank you to our panelists and to our viewers for joining YWCA Hartford Region on our mission to eliminate racism and empower women. Till next time, thank you.